आयुर्वेद फॉर ऑल, उसकी पिछली 6 कड़ी में आप हमारे साथ थे और इस बार हम फिर से आपके साथ इंटीग्रेटिव मेडिसिन फॉर ऑल, देखा जाए तो हम सेकेंड एपिसोड कह रहे हैं बट ये हमारा 8th एपिसोड है। आज आइए हम सब अपने अपने माता पिता को याद करें और अपने गुरुजन को प्रणाम करते हुए इस कार्यक्रम को शुरुआत करते हैं। इस कार्यक्रम में आज हमारे साथ ये बताते हुए मुझे खुशी हो रही है कि हमारे गेस्ट डॉक्टर गीता जी कृष्णन हैं और साथ में उनके हैं डॉक्टर विष्णु चौधरी जो कि हमारे मेघालय शिलोंग से हैं और डॉक्टर गीता जी कृष्णन WHO वर्ल्ड हेल्थ ऑर्गेनाइजेशन से हैं। मुझे आप सभी का स्वागत करते हुए अपार हर्ष हो रहा है इस मंच पर दीर्घायु भव विवेकानंद हेल्थ ग्लोबल गुवाहाटी के इस मंच पर हम लोगों में आयुर्वेद के माध्यम से स्वस्थ से स्वास्थ्य रक्षणम, हम किस तरह से बीमार होने से बचें, और इसी पर सामाजिक कार्य करने वाले एक बहुत अच्छी संस्था अखिल भारतीय युवा मारवाड़ी युवा मंच का सहयोग हमें मिला। गुवाहाटी ग्रेटर चैप्टर से हम आपका भी स्वागत करते हैं। मुझे ये बताते हुए अपार हर्ष हो रहा है आपको कि हमारे जो स्पीकर हैं वो आपको इस पेंडेमिक सिचुएशन में जीवन शैली की वजह से जो बीमारियां हो रही हैं या आप जिन तकलीफ़ों को सहन कर रहे हैं उससे आप कैसे निजात पा सकते हैं। यही नहीं, आपके जो वैज्ञानिक तरीके से जो हमारे स्टूडेंट्स हमारे साथ जुड़े हैं और जो हमारे फैकल्टीज मेंबर हैं डिफरेंट कॉलेजेस से, उनका भी मैं स्वागत करती हूँ। आपके भी क्वेश्चन आंसर सेशंस में, इंटरेक्टिव सेशन में हम आप सभी का इनका समाधान करेंगे। With immense pleasure, I would like to introduce our first guest of honor, Dr. Geetha Krishnan Gopalakrishna Pillai, who is a technical officer at TCI, that is Traditional, Complementary and Integrative Medicine Unit of the World Health Organization at Geneva. His current work with WHO entails development of global standard of practice and training in the traditional medicine, development of standard terminology in traditional medicine and data collection and analytical system for morbidities managed by traditional medicine. He is an effective self-healthcare practitioner, is an area of health promotion and is engaged in supporting low and middle income countries to develop national policies and guidance for the appropriate use of traditional medicine within their national health system. He is a researcher and clinician. His broad background expertise is in Ayurveda with specific skills, training, and experience in integrative medicine, herbal drug development, policy, and experience in integrative medicine as well as policies maker. He is a game changer, we can say like that way. As a clinician, he has 2 decades of experience, of which 9 years was spent working in a large integrative medicine faculty in India. वाह, ग्रेट सर। अगर मैं सर के बारे में बताने जाऊं तो ये पूरा सेशन मेरे लिए कम पड़ेगा, पर मैं थोड़े में आप सबसे बताना चाहूँगी। As a volunteer of Vigyan Bharati, that is a single largest science movement in India, he is the founder trustee of World Ayurveda Foundation and General Secretary of World Ayurveda Congress, which is a scientific research-based seminar every year we are conducting, and we are generating among general public as well as students and Ayurveda fraternity and other house stockholders of Ayurveda and other natural and integrative medicinal holders. So, as a clinician, you have really done many clinical trials, drug development programs. Under Dr. Geetha Ji Krishnan leadership, Medanta utilized Ayurveda and yoga therapy over allopathy in several clinical conditions. As all of us we know, हमें सभी को पता है कि जब हमें बहुत ज़्यादा क्रॉनिक तरीके से हम बीमार पड़ जाते हैं, हमें हॉस्पिटलाइज होना पड़ता है, तब हम कहते हैं दवा या दुआ ही काम करेगी। उस वक्त वैसे वेंटिलेटर पे क्रिटिकल केसेस को उन्होंने धीरे धीरे किस तरह से उनको लेकर आए। पोस्ट ऑपरेटिव कार्डियोथोरेसिक सर्जरी जैसे पेल्विक पेन सिंड्रोम जिसमें अथाह दर्द होता है, उस दर्द से उन्होंने कैसे अपने स्किल से उनको बाहर लेकर आए। इंसोमेनिया, and there are many successful stories are there. As all of you know कि कैंसर के पेशेंट को जैसे स्पेशली जैसे उनका स्पेशलाइजेशन रहा है गर्दन और सर, हेड एंड नेक कैंसर में जो रेडिएशन थेरेपी देते हैं उससे एक कॉम्प्लिकेशन डेवलप होता है म्यूकोसाइटिस, उसी के उन्होंने प्रिवेंट किया और डायबिटीज़ मैनेजमेंट को और किस तरह से इम्प्रूव कर सकते हैं. नॉट ओनली दैट, ही इज़ लाइक you can say the pioneer in the improving the platelets count in dengue fever. आप सभी को पता है during this pandemic situation also nowadays people are suffering diagnosed first with dengue fever and then they'll end up in the uh, covid positive. उस कंडीशन में भी सर ने बहुत क्रिटिकल केसेस को स्ट्रोक रिकवरी पोस्ट ऑपरेटिव जैसी बहुत सारी कठिनाइयों में से पेशेंट्स को बाहर निकाला है. सर आपका स्वागत है और मैं उम्मीद करती हूँ हमारे व्यूअर्स को आज आपको सुनने को मिलेगा. दूसरे जो हमारे डॉक्टर विष्णु चौधरी फैकल्टी कॉलेज ऑफ आयुर्वेदा नॉर्थ ईस्टर्न इंस्टीट्यूट ऑफ आयुर्वेदा एंड होम्योपैथी शिलोंग मेघालय से है. डॉक्टर विष्णु आपका भी स्वागत है. डॉक्टर विष्णु के बारे में मैं ये कहती हूँ कि इतनी कम उम्र में उनके जो अचीवमेंट्स हैं एज अ लेक्चरर, एज अ क्लिनिशियन and as a leader in what sense, he is a very encouraging for everyone for promote Ayurveda in Northeast. So again I welcome you. इस मिशन को आगे बढ़ाने के लिए आज हमारे साथ जो जुड़े हैं मारवाड़ी युवा मंच गुवाहाटी ग्रेटर के सभी सदस्यों का मैं आप सबका स्वागत करती हूँ. तो गीता जी कृष्णन सर, सबसे पहला प्रश्न है, जैसे हमने सबसे पूछा कि सर आने वाले हैं, एवरीवन वाज वेरी एक्साइटेड आपको सुनने के लिए. वर्ल्ड हेल्थ ऑर्गेनाइजेशन से हमारे पास कोई आए हैं और आप सर हमारे लिए बधाई के पात्र हैं कि आप जहां त्रिवेंद्रमपुरम से आपकी पढ़ाई करने के बाद आप पीछे मुड़कर आपने कभी नहीं देखा. और अभी देखिए हम आपको फर्स्ट क्वेश्चन जैसे सबके माइंड में आ रहा था, बेसिकली व्हाट डज इंटीग्रेटिव मेडिसिन मीन, that is you, and what is the difference between ayurvedic medicine and herbal medicine. As sir आपके बारे में मैंने सुना है पढ़ा है कि you are a drug developer and you love botany and from there I think many drugs and in different 7 areas like inflammation, pain, कैंसर, डायबिटीज़ जैसे एरिया में सर ने ड्रग्स भी डेवलप की हैं. तो सर मैं आपसे जानना चाहूँगी, आई वुड लाइक फ्रॉम यू दैट व्हाट इज़ द बेसिक डिफरेंस इन आयुर्वेदिक मेडिसिन एंड हर्बल मेडिसिन एंड व्हाट डज इंटीग्रेटिव मेडिसिन मीन्स टू यू एंड व्हाट इज़ द डिफरेंस.
Yeah, thanks, Dr. Mamta, for giving this really elaborate introduction to me. I am really thankful to you for this forum. I was always like whenever I had had a chance, I was happy to people across the different parts of the world, and this is an excellent opportunity given by you. Now, your first question was what was integrative medicine?
Yes, sir.
Integrative medicine is a very complicated term. Even though a term is very simple, but to understand that it is a bit complicated because different people have different perspective about what integrative medicine means. So for some people, integrative medicine means bringing like one single doctor practicing all medicines together. And for some people, integrative medicine means, like adding one therapy to another therapy and using it whenever a patient comes. Like you have a protocol and you always use it on a patient. So from my perspective, integrative medicine is slightly different in the sense that it is a patient-centric approach to medicine, like to healthcare. It is not at all a system-centric. It is not centric to the Ayurvedic system, allopathic system, or homeopathic system. It is actually looking at medicine from the patient side. I don't know how many of you have faced it, but most of us has faced it. Somebody in the hospital, and we do not know what to do. You really wish that the doctor was doctor who is treating your loved ones were like known to you or was related to you, or even probably very related to the patient who is there, because you don't have to worry, because whatever is required for the patient, the doctor would do. Integrative medicine is building up the medical science to a health science which is entirely based on the patient's requirement. You probably have very good evidence in one system of medicine and probably have evidence of supportive medication from another system of medicine. Bringing them together for a patient's benefit is integrative medicine for me. Like, it is not, or sometimes definitely making sure that these two systems are not brought together is also integrative medicine, because you need to know what to mix. If you don't know what to mix and then mix, you create problems. Like, we have seen that in several times. Like, there can be drug interactions, there can be procedure and therapeutics interactions, there could be procedure and procedure interactions, which are all adverse, which might be adverse to the patient. So it is an, for a doctor, it is an individual knowledge seeking program. Like, you never end learning, be trying to be an integrative practitioner. uh, Rather, a never ending educational program, and and it is a way of learning how to look at all the resources and bringing together the best of the resources without harming the patient, and for the best of the patient, for the best outcome for the patient. That is integrative medicine as far as I am concerned, and that is how I have looked at integrative medicine. And when I was practicing in my clinical, when I was practicing clinically, even now when I am practicing with my colleagues who had worked with me for about 10 years, who send me patients for their advice and for my opinion. This is what they expect from me, and this is what I look at it through. My lens is trying to get out of my physician's chair and sit with the patient's chair and try to see what is available for me. And I think that worked very well. And it especially works very well in people who, especially it works in situations where things are very complicated, where like in a tertiary care hospital, and you don't know what to do in most of the situations. Like, neither does your colleagues know what to do in most of the situations. So we have a situation where two groups of people who doesn't know exactly how to manage a patient come together and work together for the benefit of the patient. So this is what is integrative medicine for me. Herbal medicine, from the WHO perspective, is also traditional medicine. Herbal medicine usually uses herbal ingredients as drugs, and it also includes others, like programs like procedures, and also rituals, and sometimes sometimes like a combination of processes together to bring out a patient from a particular condition. So this comes under the broad term of herbal medicine when we look at it from WHO perspective. The difference between herbal medicine and traditional medicine is, traditional medicine is system-based medicine. There is, like for Ayurveda or for Unani or for Siddha or for even for homeopathy, there is a system behind it. In herbal medicine, it is one medicine, one single group of procedure for one single diagnosis. Whereas in traditional medicine, there is a system which allows you for like creating permutations and combinations and create logically available treatment methods for new diseases. That's what traditional medicine means. So but in a drug development field, herbal medicine means drugs which we eat or apply on the body, or use in some form or other on a patient, which contains herbal ingredients, or like a combination of herbal ingredients and minerals and other materials, or sometimes even not even herbal ingredients. It could be other material itself, but is different from the modern medical pharmaceutical products. So that's what herbal medicine means. So herbal medicine itself is a very broad term. It has different dimensions when spoken by different people. And Ayurvedic medicine is a traditional medicine from WHO. It's one of the most accepted traditional medicine by WHO, or rather, it is the top two or three traditional medicines which WHO always speaks about and looks at for traditional as examples for traditional medicine. So WHO considers traditional Chinese medicine, which of course includes Campo medicine, and and also not exactly includes, but it is very similar to Campo medicine, and also to the Korean medicine. And then it comes to the Ayurvedic medicine. Then Ayurvedic medicine they consider as almost all systems of medicine which has come out of the Indian subcontinent and neighborhood is connected to Ayurveda in some way or other. So WHO recognizes this. So it is quite evident from the fact that when the like the terminology is being developed, WHO is looking at it from. So I think Dr. Harsh Setia is quite a like, yeah, okay, no, that's fine. So this is the difference between uh, traditional medicine and herbal medicine and Ayurvedic medicine. But if you ask me, Ayurvedic medicine is one of the best systems of medicine, which has a logical sequencing, which is so simple and understandable for anybody who spends their time to understand it. That creating logical outcomes of clinical practice is very easy from Ayurvedic perspective. So I could take an example of COVID-19. जिस COVID-19 का जो भी अभी जो पैंडेमिक हुआ था उस समय पहले बहुत पहले around February, no, in the beginning of March, around 14 international patients got admitted in a hospital in Delhi, and we started close, and they were managed by allopathic doctors, but and at that time there was no way in which we could access these patients. Just a moment, please. I'll call you back. I'm in a meeting. I'll call you back. Yeah. I'm sorry. So these 14 patients, we worked with the allopathic doctors who were managing these 14 patients. Out of one of them passed away, 2-3 of them became very critically ill, and on a daily basis we were interacting with these allopathic doctors and collecting the information about the progress of these patients. And a group of 5 Ayurvedic doctors sat together and analyzed this data and identified the Ayurvedic pathology of samprapti of this particular disease. And that's how we came across the idea, and we confirmed that, or we were able to confirm that it is a Vada Kapha Jwara of Sanipatika origin, and there is an involvement of Pitta. Like the combination of that, once we could identify that from these 14 patients, has not changed at all. We could never find in this entire 5 to 6 months of evolution of understanding of this disease, बहुत लोग बता रहे थे कि अभी जो like बीमारी अलग हो गया, it has changed and it has become different. From when you look at it from the Ayurvedic perspective, it has not changed, because हमारा जो perspective था, हमारा जो वीक्षण था, तो बहुत बड़ा था. It was able to include all these changes, subtle changes, whereas modern medicine were not able to. When it started, there were only 3 classifications for COVID. Now we have up to F. We have 6 classifications for different conditions of COVID. Ayurveda never had this problem. Like we had this from the very beginning. We said that this is a disease which has Vada and Kapha as predominant doshas. It's the Sanipatika origin, and in certain cases there is Pitta Anubandha. Like, and then we could go back into different stages and we could say exactly when pitta would come in, and if pitta comes in, what are the symptoms which you can see in the beginning, and how it will evolve. So and depending upon the, like, there were many things which we did not discuss in the paper which we published. But if you look at that, why I am bringing you that is, based on that understanding or that logical analysis of this disease, हमारा जो ट्रीटमेंट का प्लान जो भी अभी हो रहा है इंडिया में, आयुर्वेदिक बेसिस ट्रीटमेंट प्लान has all been based on that particular analysis of the disease. So Ayurveda is something like that. It gives you the opportunity to analyze a new disease and identify new treatment procedures for it.
Very
Sorry
uh,
to be lengthy, but I think that I took a lot.
no sir, like very in depth knowledge you have given. Basically हिंदी में एक कहावत है, जिसका काम उसे ही सोहे, तो आपने बहुत अच्छे से बताया साइंटिफिकली दैट व्हाट इज इंटीग्रेशन बेसिकली. जैसे सर हियर इन मुंबई आल्सो लाइक आवर कंसल्टेंट दे आर रेफरिंग देयर केसेस टू अस,
Yeah.
and with due respect we don't change their medications. Even there is one myth among people, like they say हम आपके पास आ रहे हैं, आप हमारी एलोपैथी दवाइयाँ बंद करवा दीजिए. तो
Mm.
फर्स्ट क्वेश्चन दे आस्क्ड मी, सो आई यूज्ड टू टेल देम कि मैं यहाँ आपकी दवाई बंद नहीं करवाने के लिए हूँ, आपको दवाई क्यों लेनी पड़ी उसको समझना है आपको. एंड राइटली सेड सर, हमारा जो सिस्टम है बेसिकली वॉट एवर दैट आयुर्वेदा, होम्योपैथी, नेचुरोपैथी जो हम करते हैं उसके पीछे पूरा एक सिस्टम है, और उसको सिस्टम को समझ के ही हमें इंटीग्रेशन करना है.
Correct.
Yes sir, very correct. So now Dr. Vishnu, I would like to request you to ask some question.
Yes, yes, Dr. Mamta, Madam, you are my senior, well, and your proactive work in this for the development of Ayurveda, especially, and its integration is very appreciable. Thank you for inviting me in this platform. I am very glad to share with Geetha Krishnan sir. It's my privilege that I am meeting him in this platform. And my dear audience, we have some queries regarding Ayurveda, WHO, Northeast. So as Geetha Krishnan sir is working, as Geetha Krishnan sir is working under WHO, some disturbance is coming. Please mute, please mute. Host, please
Please
mute.
mute everyone. Mihir, mute everyone, please. Mute yourself, please.
Please mute by host also. And do.
Yeah.
By host, please mute.
वो अगर बनवाया तो जिससे बनाया वो लोग फिर भी तो कर
Mute
Please mute
host
all.
क्यों नहीं?
नहीं बना हुआ भी है, मैंने मार्केट में
Yes.
देखा है सूजन वगैरह का और क्या, तो मैंने भी को थोड़ा सा समझ में आया, लेकिन मैं किसी और को अगर मैंने बेटर मिल गया तो.
मनोज पोद्दार जी, आपसे रिक्वेस्ट है आप बंद करिए अपना. मिस्टर पोद्दार बंद.
किसी का कोई नंबर वगैरह है कि क्या?
From host side, please.
एक बार नंबर
मिस्टर
वो एक अपन वो बोले तो.
Okay. Sorry, sir. It's a disturbance. I think unknowingly they are doing. So, sir, my question to sir that what is the global scenario of Ayurveda in perspective of WHO? And one thing is there's
sorry. ठीक है मैं करूँ.
Global scenario of Ayurveda in perspective of WHO. And one thing is there, sir, we are Ayurveda is always saying alternative medicine. Can it be replaced by better word by globally? Alternative medicine is a tag in Ayurveda. So two things we want to know from myself also, audience also will be glad to know what is the perspective of Ayurveda globally in connection with WHO.
It's a very wonderful question. Basically, I would like to answer your first question, second question first, because that is quite very easy to answer, or in a shorter to answer. Basically, alternative medicine is a group of several systems of medicine. Everything that is alternative to modern medicine is nowadays called as alternate, like anything other than modern medicine is called as alternative medicine in one broad perspective. But you should remember the history of alternative medicine, you know, like the term allopathy itself means alternative medicine. Allo means the other, you know, like it is the other pati, other system, which was coined in Europe in the mid 17th or around 17th century, when the homeopathic medicine also came in place over there. You know, like you have to understand how it came up, because in Europe the system of medicine which was being practiced was a very distant cousin of the Unani medicine, which went in from Turkey and, you know, the Constantinople period, and, you know, through Greece and to Europe, and, you know, it got practiced over there. This became very during the Dark Ages and all. You know, people learned about the anatomy and everything, but they didn't know how to treat. They didn't have any idea. They could like draw beautifully. If you look at Leonardo da Vinci's pictures of, you know, anatomy, they are beautiful, but there is no sense of it. You know, like what does this beauty mean? You cannot treat even a cough. You know, like, so that actually doesn't make any sense. So it was actually a different variety of Unani medicine that was in existence in Europe at that time, and then came homeopathy. Homeopathy came up because of this bad influence of health interventions on the general health of the population. People started dying. People were suffering because of the treatments. It was really suffering. To go to a doctor means, you know, it was the most suffering thing that you can ever have. So this was the reasons. This the Dr. Hahnemann, you know, looked at homeopathy and looked at an alternative, or rather developed a medicine which is kind and, you know, very very simple to administer. And then he started calling the other medicine the allopathy, you know, the other medicine, you know, like. So if you look at alternative medicine, the true alternative medicine is modern medicine. But let us look at it from this point of view, because today if you go and tell anybody that modern medicine is alternative medicine, people won't believe it. So we have come way past that particular point in history that we can make that change. Now, if you want to make a change, which is a very happy thing, if we can do that, we need to change that in India. Like when in India, a large population, more than 50 to 70% of the population, think that Ayurvedic medicine is an alternative medicine. There is a widespread, you know, kind of a belief, or rather that is the way in which the terminology is used. Then we need to change here, and that change has to happen from our country, and then the globe will accept it. So I think we need to start working here, and we need to identify ways of getting Ayurveda as the original medicine of India, and we have to. There is a lot of work for us to do. We cannot imagine the kind of work we might have to do for the next 50 to 100 years to get into that position. You know? Like, it's a long way, and like I don't think that I'll be able to see that, but hopefully some of you might be able to see that. So that's where we are. Regarding WHO's perspective of Ayurveda, WHO has, as I told you earlier, considers Ayurveda as one of the top traditional medicines across the globe. The global perspective of Ayurveda is that there are more than 96 countries where Ayurveda is being practiced now. In practice, and you know, and like there are many countries where Ayurvedic practice is regulated. For example, if you look at, let us go from around the globe. I can just tell you, starting from Australia, New Zealand, you can go and practice there after your BAMS education. You can go to Singapore and practice there. You can go to Malaysia and practice there. You can register with the government and practice there. So also in New Zealand and Australia. Singapore, you cannot register with the government at this particular moment. Then you come to almost all countries around India. You can practice as an Ayurvedic doctor there. You know, like after completing your BAMS, then you go to Middle East. You have the United Arab Emirates, the Oman, Qatar, Bahrain, Saudi Arabia, which are countries which accept and regulates Ayurvedic practice. Of course, the best Ayurvedic practice regulations for Ayurveda happens to be in United Arab Emirates, and then comes Oman, And then if you go still further, like in that region itself, you have Ayurvedic practice acceptable, like, for example, Ayurvedic practice which can be practiced in the system through allopathic practitioners in Israel. Uh, then there are Ayurvedic practitioners in Iran, but they are basically not Ayurvedic registered practitioners. You should understand the difference. And then if you go to Europe, like most of the European countries have Ayurvedic practitioners, but the most prominent is Switzerland. Switzerland has Ayurveda registered. You have you have studied Ayurveda, you can straight away go to Switzerland and register there as an Ayurvedic practitioner, and and start practicing there. There are few things which you have to do before you do that, but still it is a big possibility. In Serbia, the health system itself has an Ayurvedic doctor. Means there is a government employed Ayurvedic doctor there. In Netherlands, you can practice Ayurveda. You can register with the medical association in Netherlands and practice Ayurveda. You go to like Germany and Italy and France and Spain, there are practitioners of Ayurveda, but these practitioners, even though Germany has the largest number of practitioners of Ayurveda, these practitioners practice with the help of the license of some other medical system. For example, either you are registered as a Heil practitioner, which is like our naturopathic medicine, but they are called as Heil practitioner, which is a European traditional medicine. It takes around 2.5 years to get that certification. Once you certify with that, then you can practice Ayurveda. Then you have modern medical practitioners who practice Ayurveda, and then there are Ayurvedic practitioners who, but like not as registered Ayurvedic practitioners there. Then you go to to the American continent. Starting from Canada, you have a medical association which registers you and allows you to practice in different provinces. You go to USA, more than 20 states in USA allows you to practice Ayurveda as Ayurveda itself, not as in any other. So if you are treating Jwara, you have to say that you are treating Jwara and practice. So that there are Ayurvedic education institutions in Europe. One of the largest, in US, in one of the largest educational programs outside India happens to be in US. Then if you come down, you have Ayurvedic practitioners in Brazil, but not well recognized. But you have recognized practitioners of Ayurveda in Argentina. And then you have recognized practitioners of Argentina. And there is a way of registering in Argentina. And in Chile, you have Ayurvedic practitioners, but not registered like in Argentina. Of course, there is Ayurvedic practitioners in Peru and such other countries also. There are Ayurvedic practitioners in Trinidad and Tobago. In Cuba, there is a government center which is run by Ayurvedic doctors. There are who practices Ayurveda. The Cuban medical system, everything is free, so you cannot have a private practitioner there. So it is a government which runs an Ayurvedic center in Cuba. So, like if you look at this, I just took up a few prominent examples across the globe. There is a huge demand for Ayurveda, and there is a huge acceptance of Ayurveda. To put it simply, before COVID and after COVID, there is a change in perspective of Ayurveda. Let me tell you, let me just give you an example of how it is. So, in Europe, the total sales of immunity-based herbal products, the share of Ayurvedic medicine or Indian medicine was something around 2 to 3% before COVID, like throughout. Now, within the short span of time during the COVID period, the percentage of products sold in Europe, only the European continent, for immunity-based Indian medicinal products is more than 15%. So you are seeing an increase of around 12% over there. Like it is a huge acceptance of Ayurveda. You can look at across the globe. I'm not talking about only India and Indian subcontinent and our neighbors. I'm talking about across the globe. You go to USA, herbal food supplements which were in the market, which were in the pharmacy shelves, were labeled as either traditional Chinese medicine food supplements or other food supplements. Like now it is Ayurvedic food supplements and other food supplements. You see the kind of, I'm talking about the way in which people are looking at Ayurveda. People believe across the globe, however much the other system is trying to say that it is because of some obscure vaccine they had given at some time in the life of a patient that patients are dying less in India. across the globe, people believe that it is because of the Indian systems of medicine that is acting in our population, that is keeping our the intensity of the disease at a low level. So that's a huge advantage for us. That is something which we should like. We don't have to take advantage of it. We have to actually uh, prove that it is a truth, and we have to behave accordingly.
Yes.
We shouldn't behave as if okay, everyone else is a fool and we will make money. That's only that we will
No.
be killing the golden goose. We should be very truthful. We should say all things that are right. We should not make any false statements. We should not make any false claims. Make, if possible, one step less claim than one step more claim. Like, and be truthful. Then the entire globe will start looking at you and believing you. And once that trust, once you get the trust, then there is no way. You asked how we can change the name of Ayurveda from alternative medicine to Ayurvedic medicine. With that trust comes the change in the name. That is the most important factor. So we have to work for it, and we have a great opportunity right now.
Thank you, sir.
Thank you,
Thank you.
thank you, thank you very much, sir. It's rightly said that charity begins at home. So, Dr. Vishnu, now question goes to you. Before
Yes, sir.
that, just I'll tell something कि सर यही कारण है कि हमें अपने घर से शुरुआत करनी है. इट इज़ समथिंग लाइक दैट, दिया तले अंधेरा. दीपक जल रहा है, आयुर्वेद से लोगों को फ़ायदा हो रहा है, पर उस दीपक के अंदर नीचे ही अंधेरा है. यानी कि हमारे अपने लोग इस चीज़ को अपनाएं और हमसे जुड़े. इसी वजह से हमने दीर्घायु भव के इस मंच पर विवेकानंद हेल्थ ग्लोबल गुवाहाटी की तरफ से हमने ये कार्यक्रम रखा. और आज जो हमारे साथ जुड़े हैं अखिल भारतीय मारवाड़ी युवा मंच, तो वो मुझसे कह रहे थे कि हमारा क्या रोल रहेगा. तो सर, आई थिंक यू हैव गिवन एनफ मैसेज टू दीज NGOs, like those who are working for day and night for betterment of society. So, sir, now we would like to ask Dr. Vishnu. Yeah,
Yes.
Dr. Vishnu, I
Yes.
would like to know about the activities going on regarding COVID-19 in with special reference to Northeast region, because it's an eye opener. जैसे सर ने पूरे विश्व में हमें एक ब्रह्मांड का चक्कर लगा दिया और आयुर्वेद का बोलबाला कहाँ है हमें समझा दिया, पर नॉर्थ ईस्ट में हमारे यहाँ पर हम क्या कर पा रहे हैं. और आपने, मैं जानती हूँ, डॉक्टर विष्णु हैज़ टेकन वेरी गुड स्टेप्स विथ हिज team members under guidance of our director sir. So please Vishnu, आप
Yes,
हमें बताएं.
yes. Thank you,
Yeah.
Dr. Mamta, madam. So, as I am working in Northeastern Institute of Ayurveda and Homeopathy, that is in Shillong, that is under the Ministry of Ayush, Government of India. So, this institute officially established in 2010, but after that formally inaugurated by our Honorable Ayush Minister Sri Sripad Nayakji in 2016. And we have at that time we have started two courses of Bachelor of Ayurvedic Medicine and Surgery, that is BMS, and Bachelor of Homeopathic Medicine and Surgery. We are offering two courses here from Nia Shillong. And in 2016 we have started our OPD and IPD full-fledged. And accordingly we have started the providing services to the entire region of Northeast. And recently during COVID pandemic, we have started first the prophylactic studies. So around 5,000 population, we have given some prophylactic medicines. In a clinical trial, we have registered. So a medicine what we have given, I don't want to disclose here, but we are giving in prophylaxis around 5,000 population we have distributed, and we have 3 hospitals. We are giving therapeutic treatment to COVID-19 positive cases. That is in mild and moderate symptom cases. We have approved through IEC and registered through CTRI. So total around 400 COVID-19 positive cases we are treating successfully. Around 350 are discharged successfully, and another 50 treatment is going on. So this is all about in Shillong. But in Assam, as you know, the Assam government, they are not directly giving any medicine to the patients. But recently they have started giving medicine to the healthcare workers, Ayush Quad and Samsamani Poti, to the healthcare workers as a preventive measure. In other northeastern states like Manipur, they are giving only chawanprash and some home remedies type ginger, amla, and turmeric combination through National Medicinal Plan Board. In Nagaland, no activities they are doing by for through Ayush. In Arunachal, they are also giving some preventive medicines like Ayush Kwar and uh, turmeric powders, local turmeric powders they are giving. This is all about brief about the northeastern state regarding COVID management.
डॉक्टर विष्णु, आपने बहुत सही और सटीक शब्दों में बताया. वी नो दैट डॉक्टर गीता जी कृष्णन सर इज मेंबर ऑफ टास्क फोर्स ऑल्सो. सो हमारा संदेश सर छोटे में समझ गए होंगे. मणिपुर, नागालैंड और जहाँ जहाँ पर कोविड-19 के केसेस आ रहे हैं, वहाँ पर हमारे डॉक्टर्स, आयुष डॉक्टर रात दिन लगे हुए हैं और अपनी सेवाएं उनको
We
दे
are
रहे
also
हैं सर.
encouraging all the northeastern, my colleagues and my friends, my junior. Though government is sometimes officially they are not allowing, but we are unofficially we are convincing or we are giving consultation. You go in this way. Somebody is asking Ayurvedic medicines, you can prescribe. This Ministry of Ayush also CCR has published a guideline for treatment protocol. We are providing them anything. They are also consulting to us. We are giving what we can do. Uh, Government, we are trying to convince the government, local governments, so that they will approve and they will understand the role of Ayurveda in management of COVID pandemic.
Yes, it's very true and rightly said by Dr. Vishnu. So I think we are coming to interactive session. Before that, sir, I would like to know about your intense work in diabetes, because nowadays diabetes is uh, like you can say every fifth Indian is going to be diabetic. And nowadays in pandemic situation, comorbidity. So how we can prevent them to getting complications of pandemic COVID-19 through our integration, our integrative principles of Ayurveda, naturopathy, yoga therapy, and of course whatever their medicines are going on. Dr. Geeta ji.
So, diabetes is, of course, as you know, it's a very complicated disease. And for us, as an Ayurvedic doctor, it is not the reduction in insulin is only incidental. It is a part of many other metabolic changes which happened. The metabolism has several factors which goes wrong, and that is what we try to identify. And we can start treating a person much before he becomes or she becomes a diabetic. So we have to in fact look at this systematic approach of Ayurveda, bring in elements of yoga, bring in elements of naturopathy, bring in elements of other systems of medicine, which allows us to treat diabetes at a very early period. Like if you look at the diabetic profile of our people right now, what you said is right. A huge number of our population above the age of 30, around 20% of them are diabetic, as you said, about 1 in 5. But if you look at the people who require hospitalization and very critical care, it is a very small minority. And it is, if you look at the treatment procedures which are being looked at, it is all to prevent people from reaching that small minority. Looking at that minority, we are actually treating everyone. Like it is like thinking that there is going to be some kind of an explosion. We are taking away all the matchsticks, from so we cannot even eat, kind of a thing. So it is not the way in which we need to address it. There are two different things. An explosion is something different, which requires one kind of an approach, whereas something of a mild heat generation is a totally different situation, which you need to address totally differently. Now, the approach of the current system is hospital centric things, and always is revolving around expecting a patient to reach the critical care unit. where every available wire is put onto you, and you are just living at the help of a machine. That's just a kind of situation people imagine. We have to change that. Like, you have to understand that, let that small 1%, whatever you try is going to be there. We are not even able to treat, we will not be able to even treat every one of those 1%, even if you try to treat everyone with good medication, because that 1% will always exist, and we don't have enough number of beds to treat them. So we should focus on the base level, where the initial periods of diabetes, early pre-diabetic situations, and such situations are taken care of. Like, pre-diabetes is one major area where Ayush system should focus on, because that is the largest number of patient load that we can ever imagine. And then keeping them healthy, preventing them from going into the next level is one of our first duty. If they go to the next level, prevent complications for them. That is where we can still intervene. If they go into serious conditions, immediately refer them to an allopathic hospital and let them take care of that. It is nothing wrong in it. Like, it is not that you have to fight with a person's life and death situation, and only if you allow somebody to 100% of the people who make sure that 100% of the people are alive whom you treat, you are going to be a good doctor. You become a good physician or a doctor even when you can understand that, okay, this is beyond my capability, or this is beyond my knowledge, or this is beyond my skill, or this is beyond my ability to treat because of different constraints.
Right.
That is what a doctor should have, and therefore we should, my advice or my suggestion or my request to all of us is that we should start working on the base level, which is the largest number of patients, prevent them from becoming diabetic, and prevent them from becoming, if they are diabetic, getting complications. And that is the area where I have worked on. I worked on a combination of drug from Sahasra Yoga, and changed it because it contained some medicines which were not available right now, or not available in large quantity. So we converted that, identified the right medicine to like like change it, like replace it, and then identified the ability of this drug to be effectively useful, and found that it was effective at a lower dose, and it was effective for free diabetic. So that's what we have done. So then we took some patents and all those things. So, like, but those are not important. These were all things which I was trying to learn. Like, now I know that those are not the important things, because like it is 15 years before you think that taking a patent gives you, like, you are the king of the world, but actually that's a wrong impression. Patents can be taken by like sending a letter to the government and saying that we want to take a patent. There is a new knowledge, there is a scrutiny, and then if you are able to overcome that, you get a patent. Like, so it is I'm trying to put it as simple as possible, but it's not so simple. But still, that is not the important thing. Our knowledge allows us to create possibilities of treating everyone and preventing people from going into serious conditions. And please understand, there will be serious conditions even if you try to treat everyone in the best of situations and with the best of knowledge and best of intentions. But that is nothing to worry about. That's a possibility, and that you have to agree with that. You have to remember that you have to know what you can do and what you cannot do. That is what Rabindranath Tagore said. You should be given with that. You should be bestowed with that, blessed with that. Like, then only you will be able to become a good doctor. This is my experience. So, like, probably other people have other experience, but this is my experience.
Yeah,
Sir, can
rightly
I
said,
add?
sir,
Yeah.
because even Dr. Vishnu has done his MD and PhD in diabetes itself. So I would like to hear him also. And before that, sir, I would like to share with pleasure that my husband, Dr. Amit Mishra, he is associated with Madhume Mukta Bharat, where under guidance of Dr. Nagratna Didi and Dr. H.R. Nagendra ji from SVS University, we did 75,000 all the Indian data, and then pre-diabetic, how to prevent them to going to be diabetic with the help of yoga therapy, stop diabetes movement also we had done. And right now one study is going on. So results are very encouraging, sir. And it is rightly said ki हमें अपनी सिस्टम पे भरोसा करना है और जो जीवन शैली में हम बदलाव ला सकते हैं। जैसे कल हमारी चर्चा हो रही थी कि हमें क्या करना है, तो मैं भी उनसे यही कह रही थी कि 2 चीज़ों पे काम करना है। एक तो हमारे अंदर जो डर बैठ गया है कि हम बीमार पड़ रहे हैं और हम अपने आप को उसी वेंटिलेटर में वहाँ पर हम देख रहे हैं इस कोविड-19 सिचुएशन में, उस डर से निकलना है। दूसरा, जो 60 ईयर्स एंड अबव के जो हमारे सीनियर सिटीज़न हैं, उनके अंदर बहुत ज़्यादा डर आ गया है। तो उनसे हमें बात करनी है, उनको हमें समझना है और समझाना है, क्योंकि वो अकेले नहीं हैं, हम उनके साथ हैं। योग, आयुर्वेद, नेचुरोपैथी और यस ऑफ कोर्स जो एक्सपर्टीज़ के साथ उनकी जो दवाइयाँ चल रही हैं, उन दवाइयों के साथ वो बिल्कुल स्वस्थ रह सकते हैं। ये हमारा एक प्रोजेक्ट है जो मैं समझती हूँ मारवाड़ी युवा मंच, अखिल भारतीय मारवाड़ी युवा मंच के साथ हमें आगे लेके जाना चाहिए और वो इसके लिए तैयार हैं। और सर, एक बहुत अच्छी बात मैंने कल इनके ग्रुप में सुनी कि प्लाज्मा थेरेपी में मतलब कितना लोगों के अंदर सोसाइटी के लिए देने के लिए इनके अंदर है। मतलब दोज हु हैव डिटेक्टेड कोविड-19 पॉजिटिव पेशेंट थे, आफ्टर कमिंग आउट फ्रॉम देयर दिस डेडली ड्रैगेड डिजीज, वो ठीक हो गए और उसके बाद में वो लोगों की सेवा करने के लिए फिर से आ गए हैं। So now, Dr. Vishnu, I would like to hear from you about your research you have
No,
done.
I want to, I did in MD level and PhD level also. So management of type 2 diabetes through rigorous mess is very commonly available. This is known also Azar in Northeast, and in Hindi also it is available in Bhavpurkas, that is as Jarul. Sir, I think you'll know is Bhavpurkas, it is mentioned as a Jarul. So as a result, I have tried in type 2 diabetes. It's very excellent effect we have achieved in around in PG level 100 patient and PhD level 300 patient I have tried. But my doubt is whether we can treat type 1 diabetes through Ayurveda. Is there any possibilities? Still, I am not convinced how we can treat type 1 diabetes mellitus through Ayurvedic medicine. Sir, can you guide us regarding type 1 diabetes management through Ayurveda?
I had worked with a group of doctors who were specializing in type 1 diabetes. I have not been able to find a single, what's it called? We were not able to find repeated benefits with different groups of medicines and therapeutic approaches we had. When we talk about type 1 diabetes, we usually used to see pediatric patients, and like they all come from different backgrounds, and then the presentation is also sometimes very different. Some of them come to know about it at very different occasions. You can imagine kids never had a diabetic patient at home, but then developing diabetes at very young age. So many a time we were working with the stress levels of the kids, and they're identifying the right kind of nutrition with these children for so that which doesn't hinder their current nutritional status and all. But basically, I think it's a kind of a we have to look at it like there are two ways of looking at it. One is we have to look at it as a like a aganduja vesha, and then treat it, because the stages of this disease, which is usually prolonged in stage type 2 diabetes, is concised into a very short period during this type 1 diabetes development. Like if you, I'm sure that if you look at it intensely enough, you will be able to see the differences in the stages. But because it is type 1 and it happens immediately or over a short period of time, we sometimes are not able to identify that. And if it is Bijotbhava, I think I don't know how we treat that at this particular moment from Ayurveda. But if it is not genetic, then probably I think it is definitely an environmental reaction. When I'm saying environmental reaction, I'm not talking about the environmental degradation or anything. It could happen to anybody. It could be a change in the metabolism which actually has happened to the child. And which is triggering a kind of a immune reaction in the body, which is killing off all the cells. But such reactions are, if you look at from the other points of view, it is like a visha. So because it acts very fast, like jwara can also happen due to aganduja factors as well as nija factors. And we know that as a jwara, there are specific activities which happens within the body, most of the jwara has pitta as a predominant thing, and similarly in diabetes also the samprapti probably like some of the factors in the type 2 diabetes is missing in type 1 diabetes, but there are stages which probably we can identify and intervene. This is like this. We work for about 2 years, I cannot offer you anything more than that. Like, but I think it is one area where we need to do a lot of work. So probably, like people say, give like this jamun ka seed mein research karna hai, etc., etc. Uh, I don't know. The fact is, like I'm ignorant to give any comment beyond what I can tell you about my experience and my thought process. But I don't have an advice to you on this.
Okay, thank you, sir. Sir, one specific question related to Northeast. Sir, as you aware that Northeast India is a biodiversity hotspot. Huge number of medicinal plants are available in the forest of Northeast. Sir, is there any new plan of Ministry of Ayush, Government of India regarding Northeast? As you know, sir, Honorable Prime Minister Narendra Modi ji is appealed for Atmanirbhar Bharat. Resource available in Northeast may be utilized for economy boosting as well as promotion and propagation of herbal medicine. Sir, what is your view in this regard, sir?
I think you brought out the right matter at the right time. In fact, after the call for self-reliance by the Prime Minister, जो आत्मनिर्भर वर्ड यूज करके उन्होंने एक्सप्लेन किया था, government of India has given a package of means commerce ministry and the finance ministry together, or rather the finance ministry has allocated a package of around 4,000 crores to the Ministry of Ayush. And let me tell you, there is a huge focus for developing infrastructure and herbal drug related programs in Northeast included in this particular program. So I understand from reliable sources within the ministry that it is still in consideration within the Prime Minister's office, or in higher up beyond the ministry's like table. So I think it goes through, and hopefully we can find this biodiversity of Northeast being conserved, but at the same time utilized at the most appropriate manner. Like it would definitely require to identify good farming methods, good collection practices, good storage practices, so that we don't waste things, and good even transportation and utility practices, even marketing, connecting to the uses of raw materials, even processing them, and probably industries might grow, agro-based industries, or like Ayurveda-based industries might grow in the country, in these states, which can be considerably useful to the economy of the place. So I hope that it functions well, and it works out well. But I know for sure that there is a huge focus on Northeast in this package by the ministry.
Thank you, sir.
Thank you very much, sir, for your this. In fact, it's a very good news for us, for everyone. And in the meantime, sir, I would request to all the viewers to put their questions, or even they can unmute or yourself after seeing one small video. I would like to request VHG Guwahati to start video. So, sir, as you told rightly, it's good for Northeast because it's biodiversity from. Yeah, sir. It's. I'll take a few minutes to just give a glimpse of this Vivekananda Health Global. It's integrative approach of Ayurveda, yoga therapy, and naturopathy, as well as acupressure. So slide you can change. And viewers, please write your questions. Everyone asked, like, uh, VHG Guwahati, please change the slide. Next slide. Yeah, so basically it has been told NCDs, non-communicable diseases. So NCDs and communicable diseases, now we are fighting with COVID-19, as Dr. Geetha ji told us. So SUSA University Bangalore since last 40 years is into this field. And as sir is a pioneer of integrative medicine, he has worked in Vedanta and he is in the advisory board of NIMHANS and SVIASA as well as IHST also. So our main aim is to preventive healthcare and disease management and of course rehabilitation also. Next slide, please. Yeah, so this is the entrance. Yeah, one by ones. Yeah. Oh, it's very beautiful. I am also seeing getting chance for first time. Yeah, yoga works a lot for our stress. Yeah. Yes, this is Vivekanand Yoga Global. Everywhere now, Vivekanand Health Global is available abroad and within India also. Thank you, VHG Guwahati. Now I would like to, yeah, these are the activities. Uh, Special SMED program developed by cyclic meditation, MSRT. These are the few techniques which we are promoting here for Vivekananda Yoga Health. Yeah, one acupuncture treatment was also there. So, and of course, diet counseling. Diet is the main factor. Yeah, so now we are here for your question answer session. So I would like to know Dr. Sharda madam is there, Dr. Nazma is here. So they can mute themselves and they can ask questions. और either डॉक्टर विष्णु आप चैट बॉक्स से आप क्वेश्चंस ले सकते हो व्यूअर्स के. या फ्रॉम नीतू सैनी देयर इज वन क्वेश्चन. Yes, doctor clearly know that their medicine is won't work beyond some time, but still there is they are hesitating to take help from Ayurveda, naturopathy or yoga therapy. That is her question, sir. नीतू आप खुद भी पूछ सकते हो क्वेश्चन. Yeah, Mahinder ji.
Thank you so much, ma'am, for giving me this opportunity. My question is to Dr. Geetha. So thank you so much for giving us such insight into Ayurveda and telling us how globally it is accepted. Thank you so much. My question is, just now you said that integrative medicine it should be patient centric. So my question is why this small thing, patient centric, is not understandable by all the doctors? Why don't they think from this point of view? Because if they start thinking from this point of view, many diseases like asthma will be treatable. Many diseases like you said, metabolic disorder, diabetes is a metabolic disorder. So beyond a point, even the medicines won't work. So why don't they switch over to other alternative medicines? Though I am still calling it as alternative medicine because that's a perspective these days. But today you just busted it that no, Ayurveda is in the mainstream and others are the alternative medicines. But still, the question remains the same. Why doctors, the so-called mainstream doctors, they do not accept the fact that they cannot go beyond a point, and they should adopt and should take help from other medicines also. That's my question.
Thank you, Neetu. Yes, sir.
Yeah,
Dr.
that's
Geetha
a
ji.
very good question. Basically, it has nothing to do with medicine at all. This the answer to the question is basically related to the training aspect and the social behavior and the social perceptions of the person who is doing this activity of patient care. So if somebody thinks that like some people, it's like some people who tries to do everything on their own. Even if somebody who can help them is sitting around them, they don't ask them. They feel ashamed of asking. There are some people who will do everything, even if it is the smallest of thing, with somebody else only. And there are some people who will call others only when it is required. Integrative medicine is like this. You call people when it is required, but it is not related to medicine. It is related to the social aspects of the particular person, the behavioral aspect of the particular person, the perspectives, and really the most important thing is the training. When training is not appropriate enough, it is not open enough, it doesn't tell you that you should look at you. It doesn't tell you that you are incomplete, and it tries to tell you that you have the best of everything and you are totally complete. Then you cannot, if you are complete, then you don't want to look at anybody else. It's a very it's a group perception, like they have to come out of it, but we cannot help them. It is unhelpable by other people. It's like somebody who is hurting themselves or others because they don't want to take help from somebody else who can help them. It is actually not the medical science that is a problem. It is the people who run it, people who train them, these doctors. It is their problem, and
Yes.
it is the society's problem. So
Okay.
yeah, so we think we should have a change in the way in which medical doctors and Ayurvedic doctors and the Ayush doctors are trained, and they have to have a way of collaborative work environment and a training environment which will allow you to do this work. And I can tell you, the way in which people who study from colleges which are combined together, for example BHU, the way in which they work together might be much more than people who work from colleges which are in silos. In Belgavi, both the colleges work together quite a lot. So the doctors in both the places do not have a problem in accepting each other. So no, I did not grow from such an environment, but that's why I'm saying it's a social upbringing that gives you this change. It's a perceptional issue.
Yeah,
Not-
thank you, sir. Thank you very much to Neetu also. And Dr. Sharda madam is there, even Dr. PJ Sharma, sir. Please unmute yourself and you can ask question. And I would like to request Dr. Vishnu, please take questions from chat box.
Yes.
Yeah, sir.
Good evening, everybody.
Uh, can we see your video, sir? Yeah, please, sir. Ask your question.
Our medicines have reference in classics, Ayurvedic classics. After that also, how to go for patency of our medicines. Because now we have some competitive world in front of us and we may lose our patency. So after having reference in classics also, do we go for this patency in the world market like for single herbs, combined drugs, minerals, or animal originated medicine like borosan, etc. So these are some questions which are sometimes disturb us.
Hmm. Like patency is like a law, like it's there is a law, there is always a way of, identifying ways of getting within that law's parameters. So if as long as a single herb which you want to patent, if you are identifying a drug, a product for a totally different use, then and you have a new process of creating this process, or you have a newly identified what's it called, element of the herbal ingredient, which will say that this is what is causing this particular kind of an effect in the patient. Then you have different ways of patenting it. You can have a product patent, you can have a process patent, you can have like even like changes in there couldn't be any innovation in your uh, uh, in your product, but there could be a new use in your product. There are different ways of patenting a product. And like I'm talking about single herbs. When you come to multiple herbs, anything beyond 5 can have multiple variations in it, as long as you can show that the variation which you have created in a formulation, or a combination, is new, that formulation has not been said anywhere. Then you can also show that this new combination had been better in efficacy than the combined effect of the individual herbs otherwise known. Then you will be able to get a patent. For example, that 5 drugs are anti-diabetic or rather has been used in different anti-diabetic formulations. You select these 5 herbs from different formulations and make one single formulation, and then you say that you see in each of these formulation, the total quantum of each of this the quantum of each of these drugs were, let us say, 5 grams. And in your like combination, the total what's it, quantum of these total quantum of these drugs together is only 1 gram. And then you are showing that your 1 gram is effective, or as effective or more effective in a specific clinical condition than the 5 grams in different which was available in different formulations. Then you have a patent. I don't know whether I was very clear about what I said, but what I meant was, if there was in one formulation, each of this ingredient was in 5 gram quantity, and then you take out all these ingredients and put them together, and you say that now I have only 1 gram of it. Totally means one fifth of this 1 gram is like one of the ingredient which I have taken from the other product, and there it was 5 grams. So, and if you are able to show that it is equally effective in management of diabetes, or more effective in management of diabetes, then you have a new product and you can patent it. You have to get a good patent lawyer to do this, because this is way of getting into the regulatory system. It is not an the patent is a very interesting process. Getting into it is trying to chip yourself, and and then shape yourself to fall in that particular silo where you get accepted in patency. And once you get the patency, or you get a patent approval, then you prevent others from getting into the same silo. That's what we do. So just because you have a patent, it doesn't mean that somebody else cannot use it. If somebody else uses it, your knowledge, knowingly or unknowingly, you will have to go and fight with them. To get into this, you have to fight, and then you have to prevent others from using it also, you have to fight. It's basically a very legally oriented process. It is in herbal industry, it is a it's a not a perfect way of like patenting process available. and there are many methods of getting patents in a herbal area. Like it is quite easy. There are considerable number of patents coming up since the time I applied for patent, that which was in something around 2003 or 4. There are considerable number of Indian patents which had been published for herbal medicines. uh, Not only Indian medical companies. There were my inspiration was a Japanese company who had taken a patent on an Indian herbal medicine, and in India. Like so, if a Japanese company can actually look at our medicine and find a combination and then make a patent in India, then I think we Indians should start learning the patent law and start working accordingly. It is because we
Yes.
don't learn the law, we are not able to formulate ourselves into placing ourselves within the law. Now we are thinking that patent is something which is hugely difficult to attain, and we start with that feeling. Understand that it is just a law, and if you study it well, you will be able to get it. It's just like getting a driving license. It is nothing more than that. As simple as that.
Thank you, sir. Very nicely and in very simple words, you have explained everything. And I think we are taking too much time for from you. I would like to request Mehender सेठिया जी और उनके टीम मेंबर्स, अगर आप प्रेजेंट हैं, प्लीज अपना वीडियो ऑन करें. डॉक्टर नजमा अहमद, डॉक्टर शारदा.
Otherwise,
I
we
would
can
like to
conclude here.
request, yeah, we can conclude now. Mehender सेठिया जी, आपको
So
कुछ
question is the
पूछना है?
one question in chat box I got. Dr. Anupriya Mahanti, she is asking, is there any
Yeah, please.
step taken to translate the institutional research observation to clinical practice? That is, we are doing. Or we are revalidating our old practices or traditional medicines or classical medicine, and new development also going on by CCRS and other national institutes also doing. Uh, Lots of research of diabetes is going on, but as Sir is telling, this pre-diabetes we can control very successfully. So that is our prime duty. There will be no diabetes in future. If we control diabetes in early stage, there will be no diabetes, and people can live longer without any complication of diabetes, as you know, kidney failure and other cardiomyopathy, retinopathy. So if we control from pre-diabetic stage by our medicine and other lifestyle changes, so we can successfully control the diabetes to that we will not be the capital of diabetes. Earlier we was there sometimes. Now I think again China is the capital of diabetes. So again, it is a high time to control pre-diabetes, so that in near future we will have less diabetic patient in our society. So
Thank you.
Ayurveda and this integrative medicine can plays an important role there.
या थैंक यू डॉक्टर विष्णु एंड आई एम वेरी थैंकफुल टू डॉक्टर गीता जी. आपने बहुत सरल शब्दों में हमारे व्यूअर्स को बताया कि किस तरह से हम जिसका काम जिसे सोए हम दे सकते हैं. आयुर्वेदा, नेचुरोपैथी, योगा थेरेपी एंड एलोपैथी, लाइक दे कैन कम टुगेदर बाय विद देयर ओन एक्सपर्टीज़, और अपने अपने एक्सपर्टीज़ को लेकर और साथ में अपनी जीवन शैली में बदलाव लाकर, और पेटेंट जैसी जटिल चीज़ों को भी हमें जटिलता में नहीं जाना है. और जैसे डॉक्टर विष्णु ने बोला, यस, हम डायबिटिक कैपिटल होने से अपने आप को बचा सकते हैं. वेरी ट्रू. और डॉक्टर गीता जी, आपने बहुत अच्छे से हमें समझाया कि ये सोशल एक्सेप्टेंस की बात है. यस, ग्लोबली बाहर के देशों में हमें प्रचार प्रसार हो रहा है आयुर्वेद का, पर हमें सोशली एक्सेप्टेंस इधर होनी चाहिए. और जैसे कि कहा गया कि डॉक्टर उस पॉइंट से आगे क्यों नहीं जा रहे हैं, तो वो उस पर्टिकुलर व्यक्ति की समस्या है, पर ऐसे बहुत से लोग हैं जो सम्मान के साथ आयुर्वेद को देखते हैं, एलोपैथ को देखते हैं. हमारे किसी भी पैथी से कहीं पर भी किसी से भी दुर्भावना या वैसा विचार हमारे साथ नहीं है. हमें एक साथ होलिस्टिक अप्रोच, हमें स्वास्थ्य से स्वास्थ्य रक्षणम जो है उसी पर हमें आगे बढ़ना है. सो गीता जी सर, मैं फिर से आपका धन्यवाद देती हूँ, और हमारे सभी व्यूअर्स को जिन्होंने पेशेंसली सुना और साथ में बने रहे, उनका भी मैं बहुत बहुत धन्यवाद करती हूँ. आइए सर, डू यू लाइक टू से समथिंग? नमस्ते सर, आप कुछ बोलना चाहेंगे?
No, it was a wonderful experience for me. I would thank Mamta ji for having done this, and also for Dr. Vishnu to have, be part of organizing this wonderful program. I think this is very essentially a wonderful thing. I hope that you will continue doing it every week, and this can be a medium by which Ayurvedic and Ayush people can come together. Not only Ayurvedic, but the entire Ayush sector can come together, and grow in importance in the place. Because the only thing which I want to say is that you cannot get importance unless and until you are useful. So that's how we become more and more useful and to the society. And when you become considerably useful for everyone, then we become very important in the society. I hope that this medium will become a major platform for achieving that. Thank you so much for giving me this opportunity.
या थैंक यू सर. हम कल फिर से सर से मिलने वाले. मैं व्यूअर्स को बता दूं, वर्ल्ड आयुर्वेदा फाउंडेशन की तरफ से जो आयु टॉक कंडक्ट की जाती है एवरी सैटरडे यूट्यूब पर वर्ल्ड आयुर्वेदा फाउंडेशन में, हम सर को फिर से मिलेंगे, सर को सुनेंगे. थैंक यू वेरी मच वंस अगेन. हम शांति मंत्र बोलते हैं एक साथ. आइए सभी. सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्. ॐ शान्ति शान्ति शान्तिः. Thank you everyone.